Americans could soon see prescription drug prices drop by up to 80%. Earlier today, President Donald Trump signed what he's calling a Most Favored Nation executive order, aimed at ensuring Americans no longer pay more for medications than people in other countries. But will it work? And what does it mean for your healthcare costs? For decades, Americans have been paying the highest prescription drug prices in the world. The same medications, made by the same companies, often cost 2 to 3 times more in the US than in places like Canada, Europe, or Japan. If you've ever looked at your pharmacy bill and felt a pit in your stomach, you're not alone. 75% of Americans find medication costs unaffordable, according to recent studies. Trump's bold move aims to change that reality through a surprisingly simple principle. If pharmaceutical companies can afford to sell their medications at lower prices to other countries,
Before I do, I'll sign one of the most consequential executive orders in our country's history. I don't think there's ever been anything signed like this, certainly not with respect to health care, nothing even close. But starting today, the United States will no longer subsidize the health care of foreign countries, which is what we were doing. We're subsidizing others' health care, countries where they paid a small fraction of what, for the same drug, that what we pay many, many times more for. And will no longer tolerate profiteering and price gouging from Big Pharma. But again, it was really the countries that forced Big Pharma to do things that, frankly, I'm not sure they really felt comfortable doing. But they've gotten away with it, these countries. European Union has been brutal. And the drug companies actually told me stories. It was just brutal how they forced them. And European Union suing all our companies, Apple, Google, Meta, they're suing all of our companies. They end up, they have judges that are European Union-centric, and they get rewarded 15 billion, 17 billion, 20 billion, and they use that to run their operation. Not going to happen any longer, that I can tell you. So what's been happening is we've been subsidizing other countries throughout the world, not just in Europe, throughout the world. European Union was the most difficult from what I understand. So for the first time in many years, we'll slash the cost of prescription drugs, and we will bring fairness to America. Drug prices will come down by much more, really, if you think 59. If you think of a drug that is sometimes 10 times more expensive, it's much more than the 59%. It depends on the way you want to analyze it, but in one way you could analyze it that way. But between 59 and 80, and I guess even 90%. So when I worked so hard in the first term, and if I got prices down, remember I was the only one to ever get prices down for a full year, but I'd get them down like 2%, and I thought it was like a big deal. Well, we're getting them down 60, 70, 80, 90%. But actually more than that, if you think about it in the way mathematically. And Pharma has to say, we're sorry, but we'll not be able to do this any longer to these countries that have been so tough. They've been very tough, nasty. It's trade. It's trade. And Pharma is also very powerful. And the Democrats have protected Pharma. The Democrats, this is the Democrats have protected Pharma. These are the Democrats. And by the way, I just called the Speaker of the House, and I just called the leader, our leader in the Senate, John Thune, Mike Johnson. Spoke to both of them. I said, when you score, you're going to have to score two things. You're going to have to, number one, score that hundreds of billions of dollars of tariff money is coming in. But even bigger than that, you're going to have to score that your costs for Medicaid and Medicare and just basically pharmaceuticals and drugs is going down at a level that nobody has ever seen before.
they can do the same here in America. Here's what happened. Just this morning at the White House, Trump signed an executive order implementing the Most Favored Nation pricing policy. The core idea is straightforward. Medicare and potentially other U.S. healthcare programs would only pay the lowest price that drug manufacturers charge in other developed countries. I will be instituting a Most Favored Nations policy whereby the United States will pay the same price as the nation that pays the lowest price anywhere in the world, Trump announced on Truth Social before the signing. He's claiming this could reduce prescription costs by 30 to 80%, savings that would benefit millions of Americans, especially seniors on Medicare. Let's break down what's actually in this executive order. First, it directs the Department of Health and Human Services, led by Secretary Robert F. Kennedy Jr., to set specific price reduction targets within 30 days. The order focuses particularly on medications with the largest price disparities between the U.S. and other countries. The policy also instructs the U.S. Trade Representative and Department of Commerce to address foreign policies that keep drug prices low abroad, essentially saying that other countries should pay more rather than Americans paying less. Meanwhile, the Department of Justice and Federal Trade Commission are being directed to crack down on anti-competitive practices that keep drug prices artificially high. Perhaps most importantly for consumers, the order expands drug imports beyond Canada to include medications from other developed nations, potentially creating more competition and driving down costs. And if you're wondering why we haven't done this before, well, we tried. Trump actually pushed a similar policy during his first term in 2020, but it was blocked by federal courts following a lawsuit from the pharmaceutical industry. The Biden administration later rescinded the rule entirely. So why might this attempt succeed where the previous one failed? Part of the answer lies in changing legal landscape. In 2022, Democrats passed the Inflation Reduction Act, which gave Medicare limited power to negotiate drug prices, removing a key legal obstacle that previously prevented such negotiations. While the Biden program ultimately negotiated prices for just 10 drugs, achieving about 22% savings, Trump's new order aims to go much further by directly tying U.S. prices to international rates. When we look at the potential impact, the numbers are staggering. U.S. drug spending exceeds $400 billion annually. Even conservative estimates suggest this policy could save Medicare over $85 billion in 7 years, while Trump has claimed the total savings across the healthcare system could reach trillions of dollars. This executive order takes particular aim at certain high-cost medications. For example, GLP-1 drugs used for diabetes and weight loss, like Ozempic and Wegovy, are specifically mentioned. These medications have seen exploding demand, but often come with price tags of over $1,000 per month in the U.S., while costing significantly less overseas. The policy also provides major relief for life-saving medications like insulin and EpiPens. For low-income Americans, insulin could be available for as little as 3 cents per unit, plus a small pharmacy dispensing fee. An EpiPen could cost just $15 compared to the hundreds of dollars many Americans currently pay. But this bold move isn't without controversy. The pharmaceutical industry has responded with immediate and fierce opposition. Stephen U. Bolt, president of the Pharmaceutical Research and Manufacturers of America, condemned the plan, saying, "Government price setting in any form is bad for American patients." Drug companies argue that their higher U.S. prices fund the research and development of new medications. They warn that Trump's approach would undermine innovation and jeopardize billions in planned investments. Some industry analysts have estimated the policy could cost pharmaceutical companies $1 trillion over a decade. Wall Street has already started reacting. Following the announcement, pharmaceutical stocks showed mixed performance. Merck shares rose over 4%, while Pfizer and Amgen gained more than 2%. However, Eli Lilly fell over 5% in pre-market trading, suggesting investors remain uncertain about the overall impact. Healthcare experts have expressed a range of views on the policy's effectiveness. Some question whether it will actually reduce costs for average Americans with private insurance, since the policy primarily targets Medicare. Others warn that pharmaceutical companies might respond by raising prices globally or delaying the introduction of new drugs in countries with stricter price controls. There's also the question of legal challenges. Given the pharmaceutical industry's resources and previous success in blocking similar measures, most analysts expect lawsuits to follow quickly. The administration appears to have anticipated this, designing the current order to address procedural issues that doomed the 2020 version. For patients wondering how this might affect their access to medications, there are both promising possibilities and potential concerns. While lower prices would certainly make drugs more affordable, some experts worry that if drug companies adjust their global pricing strategies, It could potentially lead to shortages or reduced availability of certain medications. This executive order represents just one part of a broader healthcare cost initiative from the Trump administration. On April 15th, the White House issued another order to revamp Medicare drug price negotiation laws, and earlier in May, they announced measures to reduce regulatory barriers to domestic pharmaceutical manufacturing. When we look at the history of drug pricing reform in America, today's announcement stands out for its ambition. For decades, politicians from both parties have promised to tackle high drug prices, but pharmaceutical industry influence and complex policy challenges have stymied most efforts. If successful, this policy could represent one of the most significant changes to U.S. drug pricing in history. So, what happens next? First, HHS will establish specific price reduction targets for key medications. If drug manufacturers don't voluntarily move toward these targets, the administration has indicated it will impose the most favored nation pricing through formal rulemaking. Meanwhile, expect a flurry of legal challenges from the pharmaceutical industry. The ultimate impact on your wallet remains to be seen. If the policy survives legal challenges and is implemented as planned, Americans could indeed see significantly lower prices for many medications, particularly those administered in doctors' offices under Medicare Part B. For everyday pharmacy prescriptions, the effects might take longer to materialize and could vary depending on your insurance. What do you think about this approach to lowering drug prices? Is international reference pricing a smart solution, or could it have unintended consequences for innovation and access? Let me know your thoughts in the comments.